diagnosing asthma, as we said, once again, pulmonary function testing. So they're going to look at the FEV1, the forced vital capacity. A lot of people have asthma due to some sort of reaction to chemicals, dust, antibodies, and we'll also touch a little bit on exercise-induced asthma. What asthma attacks do is they cause this huge increase of calcium into mast cells within the lungs. And so that sets off a chain reaction that leading to bronchoconstriction and of the smooth muscles. Then the vagus nerve gets involved with bronchoconstriction, and then inflammatory responses take place. And so you can see in this figure out of the textbook, so that when you have the initiators of the asthma attack, dust, pollen, tobacco smoke, pet dander, any other things that can trigger an asthma attack. So that's going to cause this huge increase of calcium into the cell, increase in cellular calcium. That's also going to cause the increase within the cell, in that mast cell, to the inflammatory response and the bronchoconstriction of the smooth muscle tissue, and also through the vagus nerve. So how is asthma prevented? Well, one of the easiest things is to avoid the things that trigger the attack. So, the increase in smoke-free workplaces and bars and restaurants, that has been really a huge help to people who have asthma. Immunotherapy, drugs. A lot of people are going to take drugs like that make the person a little less sensitive. So, to the things that cause asthma, medications, inhalers, so if asthma attacks are caused by this big influx of calcium into the cell, then a cromolyn sodium inhaler can inhibit that calcium influx into the cell. Beta-2 agonists, these are the rescue inhalers. So that's going to cause the relaxation of the smooth muscle tissue. So again, those can be fast acting, or they can be something that people take on an ongoing basis. Theophylline is another medication. So that's also going to lower the calcium in the cell. So, limit another enzyme, phosphodiesterase, which then can lead to lower calcium, but it's also caffeine-like. So if someone's taken theophylline, they may experience, tachycardia at rest. They may experience PVCs on their ECG because it is a caffeine-like substance in its structure. And then other people are going to use corticosteroids, so prednisone and other leukotriene inhibitors, and those are, again, inflammatory inhibitors that are specific to asthma. Asthma in children, it is an increase. Respiratory disorder. It's found a lot in children, particularly children that live in older buildings, in lower income communities. Does it have something to do with mold or old paint? And, so why are we seeing this increase in asthma in children? So it is the most common respiratory disorder. It is the only disease that can be reversible. So many kids have asthma, at young ages, and then as they get older, they don't have it anymore. So again, field tests, there's, peak flow meters, exercise tests. Children with asthma can exercise. Back when I was a kid, kids were told, no, if you have asthma, you cannot exercise. But yes, they definitely should exercise. You definitely want to have, medications and the rescue inhaler close by. But it is the only pulmonary disease that is reversible.